Moving on, up next we have a power-packed keynote presentation on the impact of telehealth on the quadruple aim by engineer Fadel Mahfouz, cluster leader, Philips Health Systems. Dear all, Philips is our prestigious strategic sponsor, and I welcome Fidel, and the stage is all yours.
Thank you. I appreciate it. Thanks for the new platform, by the way.
Our
So
pleasure.
let me
And we
let
apologize for
me.
the inconvenience yesterday.
No worries. Just stick around for one sec. Make sure you can see my
Sure,
slide, and then we can
absolutely.
get going. You good?
We can't see your screen as yet. Okay, it's coming up now. Yes, perfect. We can see it perfectly now.
And in presentation mode, correct?
Yes, it is on presentation mode. Absolutely.
Okay. Very good. Um, just give me a sec here. All right. Good afternoon. Good morning, ladies and gentlemen. I think my slides are probably the most used word or terminology and the most exciting word since the recent, for the past 3 years, and since the recent pandemic. It has been about telehealth. So I'll take you in the next 15 minutes over a few slides just to talk a bit about the telehealth and just to share with you, telehealth has been there for decades. As a matter of fact, telehealth has been around, I would say, at least for 2 and 3 decades. But of course, it did not gain the momentum that was needed. The year before the recent pandemic in 2019, the in terms of revenue, in terms of volume, the market size was $5.5 billion globally. So that's how much was the size of business in the telehealth space. That's again before the COVID 19. And you can only imagine what the COVID 19 has brought to us with the telehealth. Um, One of the things I think all of us agree on this conference, be it speakers or even in the audience, our healthcare industry is so slow. It does require a crisis, unfortunately, to make a move and to transform. I mean, if you look what happened during the first 6 months of the recent pandemic, you can see that we have progressed almost 10 years in the first 6 months. I mean, could you believe to have a vaccination the first 6 months? If you look, for example, you zoom to Kuwait, I think there was Shlonik, an application that tracked the patient, see if they had COVID or not. I think across the Gulf, across the world, except I think North America, every country they were tracking their patients. Before, this would probably it took ages just to get the regulators to say yes, you can track the patients, you can see if they have it or not. Patient privacy. So first 6 months, we knocked all this down and it transformed. I think for the public, if you ask them what telehealth, the first thing comes to their mind is FaceTiming their doctors. Pretty much, how to do a video call consultation. The reality is that's great, that's good. But if you look where it makes the most impact, it's when you connect care provider to another care provider. It gives them the tool to collaborate on the spot. It gives them the tool with the press of a button to pull all the history of the patient. It provides us the tools, let's say on the hospital sites, it gives them the tools to monitor 24/7 without putting the burden on their staff during the long hours and the evening. They can connect anywhere across different time zone. Pretty much, to put it in a nutshell, it level out the playing field if you live in congested area in the middle of the city, like in New York, for example, where there's hospitals next to each other, or if you live in the middle of a rural areas, where it takes you a couple hours to get to tertiary hospital. So that's what. This is where you see the value. Yes, video conferencing or video consultation probably is the most popular among the public, but I think in the next few slides you will see where it matters the most and where it makes impacts when you have these care providers and patient care providers connect to each other. So Pretty much regardless of the location, what we're doing is we're going to bring care to the patient, not the other way around. And if you've seen in Philips, we have something called quadruple aim. This is something in our DNA, it's in our vision. Any strategy is built around it, which is improve patient experience, improve the staff experience, and you want to, of course, better return of investment for our customers, for our healthcare providers, and overall, you just want to have a better healthcare outcomes, or maybe you can call it a value-based healthcare. I think this is what the new trend currently in the Middle East moving forward. And with that, telehealth has already proven its impact. And what I'm going to share with you guys is probably this is before the COVID-19, because we all know that the numbers over the COVID-19, it's pretty much, it can be an outlier. So you cannot just, we're not going to have a pandemic every day, every year. So that's why we kept the numbers up. So if you look, if I use just 4 verticals, EICU, which I'll spend a bit more time on it. So let's park this one. I have a slide on it. And the tele-ultrasound, the rural areas in Africa, this is where we have midwives had no training, and they were able to scan a patient with the collaborating remotely, and their accuracy was 99% in terms of reporting. I mean, that's great. Before, they weren't able to scan those, but with live interaction, with live collaboration with other colleagues, senior colleagues, the midwives were able to do the job. And the early warning systems, I think this is probably, it's being seen across the healthcare industry, how we collecting those data running through some sort of AI engine. It start giving us, say, patient A is going to deteriorate in the next, let's say, 2 hours, 4 hours. Patient B can be is expected to discharge, let's say, tomorrow morning. So this is what early warning systems, it's putting some sort of scoring for us to help us out for a better patient outcome. And the last one is in the digital pathology. Just think about this way, the traditional way before the telehealth, before everything was connected. You got to make the biopsy, and then you got to have that sample. I'm sure not every hospital has its own lab for pathology. So you have to drive that. You have to wait. Once it's done, you got to wait for the paperwork. So digital pathology, with one press of the button, you take in all the slides and to make it digitized, and you can get the help from anywhere to make the reading for you. So it increased productivity by 21%. So I think, as we've seen, as I've shared with you, so the impact is there. That's all before the COVID-19. And this is the EICU that stand out the most. Some people call it Tele-ICU, or Philips, our probably commercial name is called EICU. It's when you look at the studies, we have over 6 million beds. That's in 2017, I think. 6 million beds are connected, being monitored remotely globally. That's a massive number. And it has led to 26% reduction in mortality rate. I think the number speaks for itself. Also, if you look at in terms of return of investment, I mean, you're discharging 15% going home faster. That means as a healthcare providers, you can have a free bed faster than before. So you can have more, better return of investment. At the same time, your staff will be a bit relieved. And also we're discharging, when you discharge faster, this means patients are going home faster. Also for the patient, I'm sure they don't want to be in the ICU. They feel much better when they're at home. But again, think about this way. Think about this number, 26% reduction in mortality rate. I think this is what stands out the most. So where we go from now? So I think, first of all, for us being in these conferences lately, I would say month in, month out, some of us probably week in, week out, it's all about telehealth. So that's an accomplishment. Because before COVID-19, I think what I can say is some of us came finally out of, I call it the denial phase. Because back in the days before the COVID-19, and let us be frank, when you bring the telehealth, the first one say, hey, telehealth is not something that we're going to look into now. Patient privacy, there's some certain rules and regulations that we cannot patient data outside the hospital. And to be frank, certain physicians also pushed back. Certain healthcare providers pushed back. They were seeing this, that, hey, this is something's gonna sooner or later replace my job. So I think that's the best thing that probably, if there is only one good thing this pandemic has brought to us, is how to move beyond the denial phase, how to come all of us together as a healthcare practitioner, healthcare providers, companies like Philips, who we continue to innovate in the telehealth space, how to put all our efforts to make this happen. So if you look on this slide, so you see we're collecting data now. There's massive amount of data coming in, but this data is as good as how we put it into actionable insights, how we can run these data from some sort of algorithm, call it AI, I think that's the marketing word for it. And we want to spit it out in a way that can be consolidated, can be presentable for any healthcare provider in order to give them the support to make the right decision. So again, what we want to get out of this data is how can we support? It's more a supportive tool to the healthcare provider to make the best decision making process for their patients. And that's something, ladies and gentlemen, cannot be done only by companies like us. I mean, this has to be collaboration between Ministry of Health, collaboration between the hospital themselves, some entrepreneurs in the health and the physicians, because all we need to come out together because there is a lot of barriers that we need to knock out on our way to bring this to life. So Philip, I can tell you before the COVID, Philips also was only focusing on centralized care team. So if you look at the first three pictures here in this slide, it's all centralized. So where can you have a command center that you can control different rooms in the same hospital? Or you can have a command center in one hospital and it's connected to the other 3 or 4 across the systems. So it's always been centralized. But what we have learned is since now, if you want to move at a faster pace and you want to grow this business, you got to move into the decentralized part of it, where you got to give the flexibility to healthcare providers to pick and choose how they want to use telehealth. Some of them, for example, they want to use look over shoulders at certain cases. So we can call this a subscription on demand. Hey, I need to see somebody senior just to run a cardiac MR scan, for example, because my staff is not trained. So with one press of a button, you can enable this from a command center sitting somewhere. Some of them, they just want to have it 24/7 all the time. Some of them, they want to have it for a complete shift. So evening shift, for example, in the US, they would like their system to be monitored from Australia, where it's daylight for them. So nobody has to have the burden to work during midnights. So all this is coming together now. I think we all learned a lot from COVID-19. And probably this is a message more to the healthcare providers, a message more for if you have somebody on the regulatory side as well. So Philips has something called, every year we do our own report. It's called Future Health Index. So typically we survey about 5,000 healthcare professionals across 60 countries. And this survey every year, of course, we look at what's trending, and this is where we make up the questions, and then the results comes out. And it's no surprise if you look at it, guys, in 2020, I think we all want to attract the best physician to come to our hospital. So if you look what they're looking for as physicians or technologist or intensivist or nurse. So if we leave the salary out, which I think probably most of us, that will be the number one factor in terms of what's my salary would be. If we exclude that, look at it. I mean, 89% they look for workplace culture. 88% they want the latest equipment technology. This is the highest too. And telehealth, of course, as far as culture, it's bringing standardization. It avoids the burnout. It brings collaboration. So that's all a teamwork. That's a better workplace, better life balance as well. And in terms of technology, I think, as I started my slides here, Telehealth is the new buzz. This is where the technology is heading. The bus is moving, and everybody wants to ride the bus now. I don't think any one of us would like to go back prior to what the pandemic did to us. So we want to carry over with that momentum. So if you want to attract the best, the message here, if you want to attract the best workers, this is where you need to invest in telehealth because this is where they see the great value. So that's my last slide. So again, I think let's continue to work together. It has proven it has an impact. It's a great impact before the COVID-19. There's no doubt now after the COVID-19. No need to put data on. I think we are all have seen it. We've let's say we've all came into the same side now. People across the aisle. So let's put our efforts how we can make it how we can make the transition faster across the systems. So within the same hospital, you guys probably know the same hospital, there is different data comes from different places, EMR, PACS, RIS, HIS, you name it, digital pathology. So how with one press of a button we can get all this? We can get all the data together. Again, we have to put it in a presentable way that can help to make the decision process across the networks. Hospital A, hospital B, hospital C. Again, we don't need the patient to travel around to get his history. With one press of a button, we can do it, and across the departments. And if you think about it, I leave you with the last example. A cancer patient. Do you see? I mean, just imagine how many specialists he usually go through treatment, be it on the diagnostic imaging side, be it on the radiation oncology, digital pathology, you name it. So this is what all telehealth will bring all this together. You don't have to, and especially in this region where we have a lot of healthcare tourism, we call it. People try to travel abroad, either to get a second opinion or to carry on with their treatment. If you can have telehealth, I mean, this will make life so much easier, and it's all going to be connected together. So thank you. My ask is let's keep the momentum going. I think we've built. COVID-19 has given this to us. If there's only one good thing happened was the momentum that it created. So let's carry on with that momentum. And thank you so much.
Thank you, Fadel. Fadel, we have a question, right, which was actually posted for you during yesterday's session, but due to the issues, we couldn't, ask you this question. So the question is from a person called Prakash Dimelo, and his question is, due to the data protection laws, in Bahrain, Kuwait, and all other places, right? How do we ensure that patients' information is protected, because it is considered personal information, right? So how do we ensure it is protected?
No, that's a great question, Roger. I appreciate you bringing this up to the platform. As a matter of fact, probably this is the biggest barrier that we currently have. How can we ensure this? I think as Philips, what we are innovating, usually when you are collecting the data, it is perfectly secured. At the same time, it's only the data, so there is no patient name that is related to it. So we want to make sure that the tagline, when it goes, it does not contain any patient's data in it. The second thing is, and I understand, probably it's going to take us, and I think we are still working on it, to be frank with you. I don't think we have reached that far, be it us or be it other companies who are innovating in this space. But if you think about the amount of data that collecting, there's no premises that will be able to put an AI engine on premises. I think it will require a lot of space. It will be a lot of costly. So the cloud base is the pretty much. I know there is a pushback in this part of the world, but now we see them. They're starting to make moves like, yes, cloud is secure, and it will be secured. For example, if you go through Philips, so the patient privacy is secured by Philips. So this is something that they will be accountable for it. And now people are coming into the conclusion we cannot have everything on premise, because from patient privacy, the best thing is if you keep everything on premises in the same, let's say, location on the same server, so it doesn't go anywhere. But that's That cannot happen. That cannot work for the years to come. You need a massive amount of data storage. You need a massive amount of speed, and it's going to cost a lot to maintain it. While on the cloud, it's proven that it's secure. As Philips, we are committed to patient privacy, of course, and I think we will continue to support and rewrite the regulation in certain countries. And I'm happy to get offline how we can get to that conclusion soon. But we are on our way. We're not there yet. I have to admit. I think we've been challenged from a few countries yet, but I think once we will sit on the same round table, we can move faster. Not necessarily Philips, by the way. Anyone who's at the telehealth, it's our best interest to sit down with the regulators in certain countries.
Thank you, Fidel, for your valuable insights and thoughts that you've shared with us today. Do enjoy the rest of the day and the summit. And I'd like to add that I really like the Philips tagline, which says, "Let's make healthcare reach everyone, and let's make life better together." Yeah. So
Thank you.
thank you very much. Uh, Having said that, we will go ahead and screen the Philips video as well. Let's have a quick screening of the Philips video. Just to remind the audience that Philips is our sponsor, our strategic sponsor for the event. So let's go ahead and have a look at the video.
Rising to the challenge of a lifetime, but we're not done yet. Better has just begun. Let's make healthcare reach everyone. Let's push this world forward, because together we make life better.
That's a beautiful video from Philips, and we wanted to showcase it to all our delegates and panel members joining today's session. Thank you once again, Fadel.